I got so much motherfucking design on right now.
Break it down, bring it back, make it clap. I got 3 old thoughts, new block, where that thing. Bitches on my line, and you know.
Assalamualaikum warahmatullahi wabarakatuh. My name is ATIKAH binti SULAIMAN, and today I'm going to share about our client by data, which is Sir Muhammad Azharul bin Azami. So our client is now a 13 years old, gender male, with the height is 1C8 and with 68. His MI is normal. Being diagnosed with low back pain, named as intervertebral disc disorder, which is the cause of injury is due to overlifting of the back technique. So the heal duration is 4 months based on our client, and he been diagnosed in year 2022. So now let's move on to the interview that we have conducted with our client. So today we're going to do a short interview with our client. So his name is Azharul. So Azharul, may I know what is your specific injury?
So my specific injury is intervertebral disc disorder.
And may I know what is the causing of your injury?
Causing punca saya kena ataupun diagnose dengan intervertebral disc disorder ni adalah sebab disebabkan kerja lebih masa kot. Kita boleh cakap macam tu lah. Sebab saya buat satu kerja angkat barang dengan postur yang kurang betul, daripada atas hailak ke dalam kereta sorong dalam satu jangka masa yang lama dengan tak cukup air, tak cukup makan sebab bulan puasa So ianya berlaku 5 hari sebelum hari raya. So saya bekerja during bulan puasa lah.
In year?
2022, last year.
So how long it take for you to heal, fully heal?
Fully heal, I would say like a year. So sekarang baru I rasa confident lah. Oh, I pula tadi cakap saya. Tak apa lah, masih je. So bila kita start rasa confident balik tu lepas 1 tahun lah. 1 tahun lebih lah.
Jadi sebelum ni ada ambil rehabilitation?
Rehab saya buat lepas kena tu, dah diagnose MRI, dah confirm kena slip disc. So saya proceed untuk dengan fisio lebih kurang 4 bulan, 3 bulan ke 4 bulan lebih. Sebab ada certain appointment dia suruh jumpa 2 minggu sekali. So kita cakap 4 bulan lebih.
So any sign or symptom yang that you feel when you have this?
Masa kena sebelum tu, dalam 3 hari pertama tu saya just ingat dia macam sakit-sakit pinggang biasa lah. Kadang kita training ke workout lebih sikit, kadang dia sakit kan. Tapi ni dia sakit, tapi hari keempat masuk ke hari kelima tu dia rasa sakit yang lain macam. So sakit unusual feeling lah. Dia tak sama macam sebelum ni lah.
So I think that's all the question today.
Okay.
Body postures refers to the position and alignment of the body in space, specifically the way in which different body parts are positioned and relate to each other. It includes the overall positioning of the body as well as the position of individual body segments, such as the head, neck, spines, limbs, and feet. Good body posture is characterized by balanced alignment, where the body segments are aligned in such a way that it minimizes strain and stress on the muscles, joints, and ligaments. It allows for efficient movement and supports the natural curve of the spine. Proper body posture also helps maintain the body's stability and balance. On the other hand, poor body postures can lead to various musculoskeletal problems and discomfort. Common examples of poor body posture including slouching, round shoulders, and forward head posture, and excessive arching or rounding of the lower back. Maintaining correct body posture is important for overall health and well-being. It can help prevent the elevate back pain, neck pain, and other musculoskeletal issues. It is also contributes to a confident and positive appearance. Gait body posture is evaluating or analysis refers to the assessment of an individual's walking pattern or gait. It involves observing and measuring various parameters related to the movement of the limbs, joints, and body during walking. Gait analysis is commonly used in various fields such as medicine, rehabilitation, sports science, and biomechanics. It is to elevate and diagnose gait abnormalities, monitor rehabilitation progress, and also optimize the performance. There are different methods used for gait evaluations, ranging from simple visual observation to more advanced technologies. There are many types of methods. The first method is visual observation. This involves trained professionals observing and assessing a gait person's. They look for abnormalities in step length, foot position, stride, symmetry, postures, and other visual cues. Second, force plates. Force plates are embedded in the floor and measure the force exerted by the feet during walking. They provide information about the timing, magnitude, and distribution of ground reaction force. The ground reaction force is which can be useful for assessing gait abnormalities. And the lastly method is motion capture system. This system uses cameras or sensors to track the movement of reflective markers placed or key anatomical landmarks. Walking and running are two distinct forms of human locomotion, each characterized by specific gait patterns. While they both involve the act of moving forward by propelling the body using the lower limbs, there are notable differences in gait mechanics, speeds, and biomechanics between walking and running. Walking is a natural and commonly used form of locomotions for humans. The walking gaits involve a repeating sequence of movements performed by different body segments. During walking, the body weight shifts from one foot to the other in a coordinate manner. The basic components of walking gait include stand phase. This is the period when the foot is in contact with the ground. It consists of several sub-phases like heel stride. The initial phase of double support occurs as the foot strikes the ground and lasts for a short length of time. The heel of the foot strikes the ground, absorbing shock. Then, foot flat. After initial contact, the body weight transfers onto the stand limb. The foot begins to flatten on the ground and the body moves forward. After that, mid stance. In this phase, the body weight is directly over the stand limb. The foot is fully flat on the ground and the knee and ankle joints stabilize to to support the body weight. Then heel off. This phase follows mid stance and involves the transition from stand to swing phase. The heel starts to lift off the ground and the body continues to move forward. After that, toe off. During pre-swing, toe off occurs with the bare foot leaving the ground. The swing phase is initiated and the knee flex as the limb prepares for swing.
So, this is the subject Gait analysis for our client, which is Sir Azharul. So, they are divided by two terms, which is new gait and classic gaits. We have analyzed the posture of the walking gait of Azharul, which is the patients of lower back pain.
Lower back pain, also known as lumbago, refers to discomfort or pain localized in the region of the lower back. Specifically, in the lumbar spine, it is a common condition that affects the significant number of people at some point in their life. The pain can range from mild to severe and may be acute or chronic. These lower back pain subtypes are mostly determined by the length of the patient's back discomfort. To begin, acute low back pain refers to persons who have had low back discomfort for less than 6 weeks. Second, subacute low back pain lasts 6 to 12 weeks. Finally, persistent low back pain is defined as having low back discomfort for 12 weeks or longer. As a result, it is critical to always keep your back or spines in good health and condition. It is a common condition that affects many people at some point in their life. It can vary of factors including muscle or ligament strain, overstretching or tearing of the muscles or ligaments in lower back, often due to sudden movement, lifting heavy objects, or poor postures. Second, herniated or bulging disc. The disc between the vertebra can rupture or bulge, resulting in pressure on nearby nerve and causing pain. Lastly, degenerative disc disease. As people age, the disc in the spine can gradually lose their flexibility and cushioning ability, leading to pain and stiffness.
So now let's move on to the next slide. So what is actually the intervertebral disc disorder? It is one condition where the vertebral body are connected by intervertebral disc. So it has a three location, which is first one is nucleus pulposus, second is annulus fibrosus, and the last one is cartilaginous and plates, and it make up all of the discs. So it occurs when the outer ring weakens or tears, which is allowing the inner components to slip often and known as spine. So it's been divided by a fibrocartilage disc, which offer mobility and function as cushioning. That's why the slip disc happen. So as this soft cushion of tissues that outward, it called as a slip disc. So, because of this spinal cord, which is part of CNS or central nervous system, run through the midst of them, it usually can cause a painful effect to this client or the patients of low back pain. So now, let move on to the next person.
Okay, now I will present about SOAP note. SOAP note is stand for S is for subject, O is for objective, A assessment, and P is for planning. Okay, now we go to the S, that is subject. For the subject, Sir Azharul has a normal body mass index, also we known as BMI, which is 24.4 kg per meter square. He is an active person that interests in physical activity, and he one of the taekwondo coach for UiTM Pahang. Our patient routinely like to lift heavy objects like dumbbell and barbell. Doctor diagnosed that he had a slip disc because he lift a heavy object using a wrong technique. Sir Azharul has no previous lower back pain injury in his history. For the symptom of slip disc, first, feel torment in lower back, especially feel torment in buttock, thigh, and calf. Next is numbness or shivering. Individuals who have a herniated disc frequently have transmitting deadness or shivering within the body portion served by the influence nerve. For the third one is weakness. Muscles served by the influence nerve tend to debilitate. This will cause client to launch or influence their capacity to lift or hold things. And next is objective. Objective assessment in clinical testing is utilized to validate or disprove theories formulated during subjective evaluation. When examining the spine, the presence of neurological symptom or symptom referred often necessitate the exclusion of lower limb pathology. Many lower limb disorder can stem from issue related to the spine. For the observation, during the initial visit, imaging tests may be performed to eliminate other potential cause of the patient symptom, such as fracture, tumor, infection, or cauda equina syndrome. So, this is the test that commonly used to detect a herniated disc. First one is magnetic resonance imaging, or we know as MRI. Next is computed tomography. And the third one is magnetic resonance imaging. And the next is CT myelogram. And the last one is electromyography, or we know as EMG.
Okay, sir.
Atas. Duduk atas sini. Atas sana.
Okay, last side.
So now I will do a special test, which is straight leg raise test for our client. Okay, first make sure your client in a lay down position on the bed or on the table. Next, take the patient leg and flex each leg between 30 to 70 degrees. Good. So now I will press up the patient leg and see which is he still has a sign of the pain or not. So here I flex his leg, and now we can see our patient demonstrate pain sign. So he put his leg back to the bed. So that's all.
I will do a scope test for the patient for the sleep test. So, the patient must to bend himself like this position. And first of all, I will mark the first mark is at the L5, and from the L5 I will measure 10 centimeter from the L5, and upper is 5 centimeter. So how to calculate the patients who have a sleep disc, or better from the past is, if the patient is cannot bend, if the patient is cannot bend himself from the before the injury, so so the patient has still have a injury. So I will tell you how the norms for the injury.
Okay, next we go to the assessment. The injury falls within the mild to moderate range, with common cause being ligament damage and muscle strain. There is a potential risk of muscle or ligament tear in this scenario. The client mentioned that he feeling soreness primarily after lifting heavy object and from a sit position to standing position. Prolonged walking may lead to damage in the lower part of the spine. To stabilize the injury patient, the use of advanced trauma life support is necessary. If the patient's injury is low energy, a comprehensive survey should be conducted to rule out fragile injury or associated damage. After obtaining a complete medical history and performing a physical examination to determine the source of discomfort, the patient collaborate with the healthcare provider to plan a physical assessment for the injury.
Planning provide the therapist or specialist is an essential method to ensure that patient undergo the appropriate healing process by engaging in prescribed exercise that promote an expedient recovery. Typically, patient meet with a therapist either at a medical facility or at home to independently perform the exercise without direct supervision. They then schedule follow-up appointments to monitor their progress. For planning, we can plan in short-term goals and also long-term goals. The objective of short-term rehabilitation is to facilitate a speedy recovery for patients, helping them regain their highest level of functionality in a safe and comfortable manner. A multidisciplinary team of rehabilitation professionals offers personalized and comprehensive treatment and therapy to achieve this outcome. So, I will tell you the durations of short-term. The duration of these types of care and can range from a few weeks to several months, depending on the patient's individual's needs and rate or recovery. The following goals are recommended to be achieved within 2 weeks time frame. So, the first, the patients will be capable of sitting for a minimum of 25 minutes without experiencing any tingling sensation or pain in either lower extremities or SI joints. Second, with SI joints, pain rate at 5% or lower. Increase bilateral hip internal and external rotation to a level of 4/5. Third, lastly, the patient's functional abilities and performance of activities of daily living will improve by 25%. So, the long-term planning. For long-term, the objective of long-term rehabilitation is to provide patients with a clear understanding of what they can expect from the rehabilitation process and the progress they can anticipate over the course of several months. Each short-term goal is encouraged. The team closely monitors the outcomes. Adjustments to the goals may be made if a patient encounters obstacles that hinder their progress, whether due to financial constraints or other factors, or if their can recovery progress faster or slower than anticipated. It is recommended to aim for the following long-term goals within 1 month time frames, like the patients will achieve self-sufficiency in maintaining a home fitness program. Then, the patient will demonstrate bilateral hamstring and hip internal and external rotations strength of 4+/5 with SSI joint pain rate at 2/10 or lower during manual muscle testing. For the next slide, there are exercises that can be incorporated into the rehabilitation section to enhance and strengthen the back muscles targeting the existing pain for 4 weeks.
So now let's move on to the recommendations of exercise for this rehabilitation program. So the goal is to exercise the body, strengthen the core muscle, and also to get workout without putting stress on the spinal disc. So swimming is one of the best recovery technique known as active recovery. That's why we have put one of the recommendations for exercise. So there are few that recommend for our client, which is the first one is standing bar extensions, cobra pose, knee to chest rest, child pose, and the last one is me. So for swimming, it's better to apply backstroke because this technique offers lowering the probability of hyperextension.
By doing this exercise, it can help to improve your lumbar posture, range of motion, and alignment, minimize your back pain. By doing knee to chest rest and standing lumbar extension, it can help to stretch gluteus and develop hamstring or long-term flexibility while reducing stress on lower back disc.
In nutshell, having problem or injury of lower back pain may affect the gait and posture of patients based on analysis. Moreover, maintaining proper body postures also can contribute the stability and balance of the body. On the other side, uncomfortable musculoskeletal conditions can result from improper body posture. The evaluating of a person's gait or walking style is referred to as gait analysis. It entails watching and gauging numerous aspects of how the limbs, joints, and body move when walking. Thus, for those having a high risk of slip disc, there are a few ways to prevent getting injury, such as regularly doing exercise and use safe technique. If you are required to lifting heavy object. In addition, having knowledge biomechanical occupations is one of the advantages, as it can decrease the risk of injury that may contribute in any further injury.